Hello, hello, and welcome to your virtual classroom. Coming to you from my living room because I'm actually in Scotland, probably hanging out with some Highland cows, and can't be with you guys this week. So, welcome to your week 3 administering medications part 1 lecture. This lecture will probably be shorter than normal because we don't have that same classroom interaction and those questions that we can go through. So you probably won't have to watch for the full hour. This probably won't be a full hour, but just so you are aware, we will be discussing administering medications in 2 different parts. Today, we're going to be talking about the legalities of medication, what the roles and responsibility of the veterinary team is, as well as diving into the different types of medications that exist and the parts that VAs will actually administer into the animal's body. Just a reminder that you do still have lab on Wednesday, starting at 11 a.m. as normal. You're just going to be hanging out with Erin, Christy, and Tanya instead of me, Christy, and Tanya. Christy's going to be leading you guys through your groups and how we're going to be setting up for the lab this week. So please give her all your attention and respect and professionalism. And then we will get through that. Don't forget that your medical record is due on Wednesday and your weekly reflection from grooming over the week 2 will also be due on Wednesday this week at midnight. We will also have a medical record 3 and a weekly reflection 3 that will be live for you on Wednesday as well. So let's dig into some of this material here. Okay, so starting off with small animal roles with medicating. So we're going to focus more on the small animal side of things, not so much the large animal side of things. So small animal role when medicating. So the veterinarian, these are the people that are prescribing the medication. So they can diagnose, prescribe, perform surgery, and prognose. So prescribing the medication is only the task of a veterinarian. RVTs like myself and VAs like yourself cannot prescribe medication. So prescribing of the medication is strictly a veterinarian's position. They're going to calculate the dose and the duration of that medication, and they can also fill that prescription. So once they've come up with that dose and that duration, they can then fill it themselves if they want to. I would say oftentimes in clinic, this is a technician or a VA that's doing this, but they can legally fill that prescription as well. They can administer all forms of medication. So they can do injectables, they can do oral medication, inhalants, any type of medication on the market a veterinarian can do. Veterinarians have the widest scope of all of the levels inside of the veterinary team. So they can do everything that we can do, as well as prescribing the medication, which we cannot do. So then going into that veterinary technician role, these professionals can calculate the dose and the duration of the medication. So say we're going on a 14-day course of antibiotics, we can calculate that dose, confirm it with a veterinarian, and then fill that prescription subsequently. So we can calculate dose and duration. We can draw up medications. Specifically, this is done a lot in surgery. And then we can fill that prescription as well and dispense it. We can also administer all forms of medication. So under the direction of a veterinarian, we can administer all forms, injectables, orals, inhalants, same as a veterinarian would. The veterinary assistant is a bit different because they can't administer all forms of medication. Legally, they can under the direction of a veterinarian. We won't be teaching you injectable medications in the VA course. We'll teach you pretty much everything else, but we won't be teaching you injectables within the VA course because injectables have a higher risk. So if you want to learn injectables, that's the VT course that you guys can get started and apply for. But right now as a VA, we are going to be sticking to the other forms of medication. But you can fill a prescription under the supervision of a veterinarian or veterinary technician, meaning that a technician can give you a prescription label and you can count those drugs and put them into the bottle, put the label on, and dispense them out to the client or administer them subsequently yourself. Like I said, you can administer most forms of medication under the supervision of a veterinarian or veterinary technician. The exclusions are going to include injectable medications, some controlled medication, some inhalants, specifically anesthesia. So you guys are not trained enough on anesthetic monitoring. So administering that medication and not knowing how to monitor it can be really, really dangerous. So you guys won't be doing any inhalant anesthesia. The shared responsibility. So we talked about team-based medicine all last semester, and we talked about communication, how communication creates a positive or good culture within the veterinary team. So DVM, RVT, and VA are all responsible to work as a team to ensure the accountability to administer the correct medication, the correct dose, the frequency, and in a safe and appropriate manner. So I'm going to repeat that. The DVM, RVT, and VA are all responsible to work as a team and ensure the accountability to administer the correct medication at the correct dose of that medication, in the correct frequency of that medication, and within a safe and appropriate manner. So this means that as a VA, if we get handed something from a VT and we're like, that looks a bit weird or odd or high or low, that we question it and we go, can I just double check the math, or can I see what your math is, or can we double check this? Are we sure this is correct? Can I ask why this is correct? And we question it because on average and statistically speaking, if someone is going to incorrectly administer medication, it is going to be by 10 times. So the decimal point is 1 over or 1 over. And as you can imagine, doing 10 times under is going to be a lot less scary than doing 10 times over the medication. And so we want to double check math. We want to double check that everything is correct, because if it is, then we've followed this accountability model and we can safely administer this medication in an appropriate manner. Medical records need to be updated and completed every time a medication is given. This is a requirement through the CBO. So this is law. This is a requirement through the accreditation of the facility. Anytime that medication is being administered, it needs to be in the medical record, because as we know, and I've said it time and time again, if it's not in the medical record, it didn't happen. And imagine if it's not in the medical record and someone reads that and goes, oh, so that medication wasn't given yet. Perfect. I'm going to go give it. And now we've double dosed that animal on a drug that we shouldn't. When we're talking specifically about medication administration, this level of accountability is extremely important, because this is where the highest level of risk to our patient is as a VA. We can talk about physiological and psychological needs and keeping them safe and comfy and warm, but when it comes to medicine, this is where the risk is. And we need to ensure that we are properly caring for the patients from a team approach. So if you feel uncomfortable questioning a DVM or an RVT, you shouldn't be uncomfortable doing that, because you guys work collectively as a team. And if the DVM missed it and the tech missed it and you caught it, you just possibly saved a patient's life. So always question things when you are unsure, or even if you're calculating doses and you're not sure about your math, have someone check it. Always, always, always double check your work. The controlled drug log needs to be updated and completed whenever a controlled medication is used. We're going to talk about controlled drug laws in a second, but controlled drug logs are different than your normal medication logs. And then we'll talk about why that exists in that manner and what audits are a little bit later in this slide. So controlled medications, these are tracked by the government. There are often specific regulations on how they are dispensed, and typically include medications with addictive risks or medications commonly misused by humans. What happened during what is still the opioid crisis is medications were being administered to animals, and those owners would take those medications instead of the animal, or they would sell those medications on the street. That's what created the controlled drug log. And unfortunately, because humans tend to not completely comply in these scenarios, they abuse the system, which creates these intense laws. So the controlled drug log um, must be used every single time you use a controlled drug. So you must write down exactly which drug you're taking out and how much. And a controlled drug log is actually separated by the drug type. So if buprenorphine is taken out, it's in a controlled drug log. Buprenorphine is its own sheet. If tramadol is being taken out and that's a controlled substance, it's going to have tramadol along the top, and then it's going to have the patient ID, the person that's taking out, how much is being taken out. All of those things are going to be within that specific drug log. So then if we're taking out euthanol and we control it properly, then we really shouldn't have much of an error in between maybe some medication loss when we're drawing up differently. And so if we are really, really off, we are going to need to question why we are that far off. Is it an internal mistake and an honest mistake? Could somebody possibly be misusing drugs within our facility? Is someone dispensing drugs without actually recording it? These are all concerns that we have, especially when using controlled substances, of which humans have a tendency to abuse. The responsibility for keeping the controlled drug log up to date is by all the DVM, RBT, and VA. We are all a team and responsible for it. It's a requirement under the accreditation of the facility, which means that we must, as a team, uphold the level of the law. Examples of controlled medications, like I said, narcotics, opiates, so buprenorphine, morphine, all sorts of different narcotics, euthanol, which is actually called pentobarbital, and certain anesthetics as well are going to be under the controlled substance. So accredited facilities carrying controlled substances must complete monthly audits of the drugs in inventory that fall under the Controlled Drug Registrar. So Controlled Drug Registrar is a federal law, and that explains which drugs are considered controlled substances. And then we, as a veterinary team, must do a monthly audit where we draw up all of the medication that we have to ensure that we have the right amount that is listed in our drug log. Because what we'll do is we'll have 250 milliliters, for example, and then we'll decrease that every time that we take the medication out. So we should only have between 0.1 and 0.2 mils loss due to withdrawal. So that's what's going to hold into the hub of the needle and not actually be injected in the patient is 0.1, 0.2 mils per withdrawal. So we're going to compare our actual inventory to our expected inventory, and these numbers should be identical or very close. So like I said, we do have an allowance for withdrawal, and we do have allowances for mistakes as well, but very, very minimal allowance for large changes. So this is what an example of an audit tracking sheet is. So you're going to do your date of your audit name. This is because if the CBO has questions, they're going to ask you, if you're the auditor, exactly what you did and your checks and balances in between things. And they're going to want to make sure that everything is in order so we can properly track these substances, because these are dangerous things out in the real world. And if they're inappropriately tracked and the audits aren't matching up really well and we don't have explanations for it, we need to investigate further. And then this is an example of a controlled drug log. So as you can see along the top, there's the name of the drug, the form of the drug, the strength of the drug, and the size. And then every time that we take this drug out, we're going to put the date, the client ID, the client address, the animal ID, a signature of ourselves that are taking out that drug, the amount that we've deducted, any added amount. So if we're putting more medication or adding inventory, so if our veterinary purchasing order comes in and we ordered more euthanol and we have 250 milliliters more, we're going to put an amount added of 250 milliliters. And then if we take out 50 milliliters, we're going to do amount deducted 50 milliliters. And then we're going to do the math. So your previous number minus or plus your new number, and then see what the balance is of the amount of inventory of that drug that we have. And repeating this one more time, this is a requirement by law. This is not optional. This is not best practice. This is a requirement for every single practice to maintain a controlled drug log. So going into forms of medication. So we have tablets. These are all oral medications. So tablets, these can be coated or uncoated. The coated ones work way better because they don't taste as terrible. The uncoated ones taste like chalk. If you've ever had like a really chalky medication, dogs really hate uncoated meds. Cats will actually like vomit them back up because they really don't like them. These can be scored or unscored. So this is that line down the middle of the tablet. And actually what you can do with that line is you can break the tablet and just like put it against a table and break that tablet into smaller quadrants or halves. And that's how we can better manage the medication or the dosage and make it a little bit more flexible without having to compound new medications every single time. Some medications can be sensitive to light and moisture. So obviously, if it's a tablet, it can dissolve. So almost all oral medications are going to be sensitive to moisture, and we want to keep them sealed in a bag in a place that's not humid, and usually just in a dry cupboard. The medications that are sensitive to light are going to come in a brown bag. And that's because as light gets into the medication and penetrates the actual cellular walls of the tablet, we are actually going to reduce the efficiency of the drug. And so basically eat the drug by using light. Another form is capsules. These can also be sensitive to light. They're very sensitive to moisture. Anytime that we usually use an oral medication in clinic, we want to do a water chaser after they've been administered that tablet. That's just going to help it from getting stuck or stick to the esophagus as it goes down. Chewables, these are generally flavored. I would say normally bacon flavored or chicken flavored. These tend to do okay with animals. Typical chewables that we would see, there's an Apoquel chewable, which is an allergy medication. There's now a Medicam chewable as well, which is a non-steroidal anti-inflammatory. Which is great because that drug used to be just a liquid and used to like shoot it in the side of their mouth. And dogs really didn't always enjoy that. Cats really didn't enjoy it. Now it comes in an actual chewable form. So these animals are getting the pain medication that they need in a chewable format. But the most generalized chewable drug that we'll see on the market is going to be our flea tick medication. Pastes, these aren't always used. I see them in mostly nutraceuticals and probiotics. But we can use pastes in horses quite often with dewormers. Sometimes we'll use them as dewormers in dogs too, but typically pastes are used in the larger animal. We tend to use powders more often. So powders, probiotic powders, antifungal powders. There's lots of different ways that we can use powder. These can be flavored or non-flavored, same as pretty much every oral drug on the market. And then we can get into liquids. So liquids can be sensitive to light, so they need to come in a brown bag and they need to be stored in a dark, dry place. They can be flavored, they can be not flavored, and we usually are going to want to shake them before we're giving them. However, there are medications that we don't shake. So ensuring that we have a proper label on our drugs is going to ensure that they're actually getting the medication that they need by either resuspending it by shaking it, so resuspending the drug in the liquid, or not shaking it because that can ruin the molecules. So insulin would be an injectable medication that we shouldn't be shaking, but there's a couple on the market now that you do vigorously shake to resuspend. Sometimes liquids need to be stored in the fridge. Sometimes they're fine at room temperature. Medicam is fine at room temperature, but there are medications that should be stored in the fridge. Topical medications. These are your skin condition medications, lesion medications, anything that could be topical like antibiotic cream. We're going to use transdermal cream, liquids, ointments, drops, tinctures, shampoos, and mousse. If you have dogs that have yeast infections, we can use shampoos and mousse. Our ringworm cats at HSLM, those guys get dipped in a shampoo every 2 or 3 days for their ringworm, and they basically get dropped and submerged into a topical treatment ointment and back up and then dipped down again. We also have sprays. that we can use either in the mouth, in the ears, along the dermal plane. Pretty much anything that goes on top of the skin without going inside of the body is a topical medication. When we talk about PPE for topical medications, this is really, really important because we need to wear gloves when administering topical medications. There are carcinogenics, which is a drug that could cause cancer. There are several carcinogenics in the animal world of drugs, and if we're putting carcinogenics all over animals all day, every day by just using our bare hands, we have the potential to introduce those carcinogenics into our body because, as you can imagine, topical medications are absorbing through the skin. So if we are going skin to skin contact with those topical medications, they're also absorbing into our skin, and we don't need those drugs. So make sure we're having the proper PPE and using gloves when we're administering any topical medications, especially if we're using our hands to rub it in or spread it on the body. Injectables. So like I said before, VAs typically don't do injectable medications. Sometimes they do in certain clinics. I would say some clinics will do subcutaneous injections, but won't go into intravenous or intramuscular unless you're an RVT. Intravenous is in the vein, so that's where we are doing blood draws. Usually a technician is going to be doing that. Intramuscular, we have several muscles that we can use. We have quad muscles, we have apaxial muscles. There's lots of muscles around these these injections can sometimes be a little bit more painful, as you can imagine from your rabies shot. That was also an intramuscular injection. They hurt. So typically, if you miss the muscle, you have some risk around that. So an RVT would be administering intramuscular injections. Subcutaneous is under the skin. So you can tent the skin up, make a little pyramid, and then you put the injection through that little hole there, and it's just going to sit under the skin and absorb slowly. So medications that we could use is lactated ringers or intravenous fluids. If animals are dehydrated, kidney cats are number one for subcutaneous injections, and they basically create little bubbles of fluid along their back and actually helps them stay hydrated that way. So inhalants, common types of inhalants include bronchodilators or asthmatic cats. So whoever saw that cat open mouth breathing or open mouth panting at HSLM last week, you will probably know that this animal is getting bronchodilators. So bronchio, your bronchioles in your lungs, dilators, making them bigger. So it's dilating the bronchioles and increasing our lung capacity to absorb oxygen and help these animals breathe better. Anesthetics. So typically isoflurane is used in small animal practice for our anesthetic under like general anesthesia. Other ones that you might know is sevoflurane, that is usually used in humans. And then we also have nitrous oxide, which is laughing gas that you get at the dentist. Oxygen, obviously an inhalant. We require oxygen to survive, and typically used in emergency situations when animals aren't oxygenating or perfusing very well. So key points. Medical administration has paperwork and logs attached to it to protect the public from misusing drugs. These are our controlled substances, but we also keep drug logs and audit normal medications. We are just way stricter with controlled medications. Inappropriate handling of medications can cause accreditation risks to the practice. That's the legality of it. But the reality is that inappropriate handling of medications will cause significant harm to your patients or yourself. This is a safety concern. When we are administering medications, they have an effect on the body that we can't fully control once they're administered. So if we are double or tripling dosages because we never double checked work, we have a really high risk of significantly hurting a patient, if not killing them. VAs can be held responsible for medical administration and logging medications, including filling a prescription. So that's the counting of the medication. And you guys can be held responsible for that. If someone is delegating you that task and you feel uncomfortable doing it, you need to say, no, I do not feel comfortable doing controlled drugs. I do not feel comfortable being held responsible for this administration. And then someone can either train you on it so you can become more comfortable, or someone else can do it, because you are responsible for the patients that are in your care, even as a VA. And you guys need to work as a team with your RVTs and your DVMs to continue the constant communication and ensure that we're administering medications appropriately and within a very safe manner. So just a reminder, because we are heading off into the end of this lecture. So you still have lab this week with Erin at HSLM, 11 a.m. Failure to be present means that you are going to lose marks for that lab. You are not going to get graded for your medical record or your weekly reflection. Your medical record for week 2 and your reflection for week 2 are still due Wednesday at midnight. If you guys have any questions, please shoot me an email. My phone will be on. I just might be a bit delayed responding to you while I'm away, but know that I'm having fun. I think I'm flying out in about, I don't know, 6 hours or so. So I'm going to go get packing. I'm going to go finish packing, get my animals settled and ready to go, finish up a couple things here. But if you guys have any questions when you guys are reviewing this, please, please, please reach out. Have a good day, guys. Bye.